Good day everyone, my name is April Jinsi Inano and I will going to report what is deaf blindness. So deaf blindness, it is a combination of sight and hearing loss that affects a person's ability to communicate, access information and get around. It also sometimes called dual sensory loss or multisensory impairment. A deaf-blind person won't usually be totally deaf and totally blind, but both senses will be reduced enough to cause significant difficulties in everyday life. These problems can occur even if hearing loss and vision loss are mild, as the senses work together and one would usually help compensate for loss of the other. Most commonly affects older adults, although it can affect people of all ages including babies and young children. In older people, it may develop gradually and the person themselves may not realize their vision and or hearing is getting worse at first. So, signs of a problem include needing to turn up the volume on the television or radio, difficulty following a conversation, not hearing noises such as knock at the door, asking others to speak loudly, slowly, and more clearly, needing to hold book or newspapers very close or sitting close to that television, difficulty moving around an unfamiliar place. If someone already has either a hearing or vision problem, it is important to look out for signs that suggest the other sense may be getting worse too. So what will you gonna do when you have a deaf blindness? So visit your GP if you think your hearing or eyesight may be getting worse. Or if you're worried about a friend or family member, encourage them to speak to their GP. It's best to seek advice as soon as possible as treatment for some underlying causes of deaf blindness. Causes of blindness. Causes of deaf blindness include age-related loss, age-related hearing loss, genetic conditions such as Usher's syndrome, an infection in a baby in the womb such as rubella, a German measles, cerebral palsy, a problem with the brain and nervous system that mainly affects movement and coordination, eye problems associated with increasing age such as cataracts, and so how's the life living with deaf blindness? So a range of care and support services is available to help. Each deaf blind person will have a different level of hearing and sight loss, which means they have their own individual care needs. How to care a deaf-blind person? So, the general aims of care for a deaf-blind person are to preserve and maximize any remaining sight or hearing the person has. This could involve treating underlying conditions like cataracts, wearing glasses or using a hearing aid. Teach alternative methods of communication such as hand signing or braille. Help retain or develop as much as independence as possible. For example, by training the person to use a long cane, a guide long, or offering a communicator guide. So that would be all. Thank you.